What exactly is a pelvic floor?
So the pelvic floor is actually a group of muscles, ligaments, connective tissues that help.
Can the pelvic floor affect, painful sex?
Absolutely. Number one, it's hard to talk about sex without saying the word vagina.
Say it,
right?
Vagina. Say it.
We
Vagina.
have so many euphemisms for vagina. Down there, fanny, tutu, cha-cha, foo-foo,
bet you've heard them all.
Oh, I've heard them all. I mean, in the South here, we're a little bit more proper. So
That's
it's like
true.
pocketbook or...
Oh, your pocketbook.
Pocketbook. Cookie. I've heard it all, man.
I now have a new name for mine. Well, how I was taught to do a Kegel is to, quote, close all your holes. And I'm like, what does that
What does that mean? Yeah.
What? Yeah, so
Yeah.
I feel like this is something that could be taught a lot sooner. I am a huge fan of yoga. I've been practicing yoga since I was 19 years old in the basement of NC State University in the weight room. That was my first yoga class, and I still do it. I'm 46, so it's been a long time. Before I had my son, yoga was literally a part of my daily life. I even became a yoga teacher for a while. I even certified myself in prenatal yoga while I was pregnant. I was the class dummy in these classes. That's how dedicated I was. But after I had my son, I stopped for a really long time. And why, do you ask? Well, I was so excited to get back into my practice right after my son was born. It was literally part of who I was, going to yoga, practicing yoga every single day. So I went to my first class after having my son. I breathed in, I breathed out, and we started doing our sun salutations, and I lifted my arms above my head, and I went down into my first downward dog in months. And that's when my yoga became musical. In fact, anytime my feet were anywhere outside of hips distance apart, there was a sound coming from my nether regions that signaled that things were never going to be the same. I cried, I panicked. I was devastated. Honestly, I was truly devastated. And I spoke with the teacher afterwards. I was so embarrassed. I was like, how? I need yoga. How am I going to be able to do yoga again if I'm the one in the back of the class that sounds like a whistle whenever I do three-legged dog? And she said, you need to strengthen your pelvic floor. And I said, well, why did nobody warn me that my pelvic floor was going to be so stretched out after having a kid, and that musical yoga, damp trampolining, soggy sneezing, all of this was coming my way, and all of it was news to me. So how do you strengthen your pelvic floor? And what the hell is a pelvic floor? And is there a pelvic ceiling I need to worry about? Honestly, y'all, my name is Sarah, and I have some questions about your pelvic floor. All right, today's doctor, the one who's brave enough to tackle my questions, is Andrea Crane, MD. She's a urogynecologist and OBGYN. What is a urogynecologist?
A urogynecologist is actually a fairly unique specialty that combines urology and gynecology.
Okay.
So we focus particularly on the pelvic floor, and it's the specialty. It's considered somewhat new, but we've been around for a while.
Oh, interesting.
Yeah.
Okay,
and it became a formal specialty a little bit over 10, 13 years ago.
Okay,
yeah.
well, that brings me to my next question. Why have I only now, about 10 years ago, I'd say, maybe, that you started hearing about the pelvic floor? My mom, apparently it's been there the whole time. Yeah. My mom never mentioned it when I was growing up. So why is that?
I think as a society, we've had a shift, and, many women don't feel comfortable talking about this. Right?
Oh, yeah.
Generationally, it's like, oh, this is just something we dealt with.
Yes.
Oh, my mom had this. This is what happens.
Yeah, and it was always whispered.
Exactly. And now as a society, it's like, hey, let's talk about this. And women are more active in the workforce overall, and people are very active. And when you're more active, things happen to you, right?
Yeah.
And so we just talk about it a little bit more, and I think it's good to unveil that, and just recognize number one that it is very common to have some of these disorders. We'll talk about, you're not the only one. A lot of women have been suffering in silence for years.
What exactly is a pelvic floor?
So the pelvic floor is actually a group of muscles, ligaments, connective tissues that help kind of as a bowl in your pelvis. So they help support up your female organs, of course, as well as your bowel and your bladder.
Okay.
So if there is a disruption in your pelvic floor, whether they've gotten weaker with time or there's an actual break in it, things might not be as optimal. You might have difficulty controlling your bladder, controlling having a bowel movement, as well as pain with sex.
Oh, wow.
So commonly, women can also have their internal organs slowly come down.
Oh, dear God.
After they've delivered children or with age, after going through menopause, and that's called pelvic organ prolapse.
Oh,
so
wow.
it could be either their bladder, their bowel, or vaginal tissues.
So, Lord Almighty, that's just a horror of all the things.
It is more common as than you think, Sarah. About 1 in 3 women have some kind of pelvic floor disorder.
Wow.
Yes.
So, what can we do? Like, so you mentioned that as you age, so is there? It doesn't matter if you're getting older and have not been pregnant. It just these types of things just happen.
So there are definitely a variety of risk factors.
Okay.
So there is a little bit of genetics involved. There's some hereditary component.
Okay.
Some women have not delivered children,
right,
and they will have pelvic organ prolapse. Actually,
so
not as common
right,
as a woman who has had a vaginal delivery.
Well, it makes sense with a vaginal delivery because everything gets stretched out.
Yes.
But what if it happens if you have a C-section? Does that make you just as vulnerable?
So sometimes not as much, but it depends on the circumstances for the C-section. For instance, they might have been pushing for 2 hours before they had the C-section.
Okay.
You know, and so anything that increases the pressure down below.
That was
when
what
you think
my
about
next
it.
question was. If you have a baby, you're heavier.
Yes, but also chronic constipation. Chronic smoking can be a hard thing because the smoking can decrease the strength of your connective tissues. Plus, they're chronically coughing. Usually, a lot of smokers end up coughing quite a bit, so that it can be a double whammy.
Oh, interesting.
So, if you have weakened connective tissues, whether it is from diabetes, other connective tissue issues, disorders, that certainly can contribute to it as well.
I'm learning so much in this moment. So, diabetes and smoking can both affect your connective tissue.
Yeah.
How?
Yeah. So decreased vascularization to the area.
So they don't get as much blood.
Yeah.
Yeah, that you're speaking in doctor's terms.
Yeah.
Yeah. Okay, well, what can you do about it?
So I think number one is just recognizing that it is a thing. You are not the only one, and kind of normalizing it almost. Although we say it's common but not normal part of aging, right?
Okay.
So it's common. So then number one is just recognizing that, hey, it is there. And then what options do I have?
Like, when should we start learning about this? Because I feel like after I have a baby and I go to a trampoline park and I wish I had a poise pad for the first time in my life, should not be the first time I've heard of a pelvic floor.
Yeah. It would be great if we had some, some health education about it, even in
middle school.
Absolutely, because I think there are actually some young girls who already have some issues with exercising, and hey, I can't hold my pee.
So you think, is it from over-exercising?
So not necessarily. I think in those situations, there's a little bit more of a genetic component.
Yeah, that makes sense. Yeah,
for sure.
That makes
so
sense.
there's some women who, hey, they can do CrossFit and they're fine.
Right.
Other women, most women in their 40s,
Yeah.
it's hard to do that and still not have some leakage.
Oh, yeah. Let me just say I did burn boot camp in the jump roping section of the workout. I'd often take breaks to go to the ladies' room because I'm like, this is gross. Well, let's talk about sex.
Yeah.
Just like, let's talk about sex, baby. So can the pelvic floor affect, like, painful sex?
Absolutely. So I think, number one, it's hard to talk about sex without saying the word vagina.
Say it,
right?
Vagina. Say it.
We have
Vagina.
so many euphemisms for vagina. Down there, fanny, tutu, cha cha, foo
I
foo,
bet you've heard them all.
Oh, I've heard them all. I mean, in the South here, we're a little bit more proper, so
That's
it's like
true.
pocketbook or
your pocketbook.
pocketbook, cookie. I've heard it all, man.
I now have a new name for mine.
Oh goodness. But I think it speaks to the in volumes in the sense of somehow we feel not comfortable with saying that anatomic word vagina.
Right.
And so in the same way, we also don't feel comfortable talking about sexual dysfunction.
And is this something
or pain with sex?
Right. Well, should you be talking to your gynecologist about this? Your primary care provider? Who do you talk to about it?
So it would be great to talk to your primary care and your general gynecologists about this. And a lot of general gynecologists can help with these issues.
Yeah.
As well as if it's not optimal, they'll refer over to a urogynecologist at times.
Okay.
Depending on what's involved.
Right.
Just to, again, let you know how common like female sexual dysfunction is, it is estimated it can be up to 40% of women.
40%.
Is that crazy? And, with media, you think it's every time it's going to be something you want, something you enjoy, and pain-free. And it's not always the case.
For most, almost half the population.
And sometimes, and it's a complex issue, right? Because there is the desire, which can be modulated by stressors, psychological factors, medical condition. If you've had a painful sex, whether it's anything recent or a history of trauma or abuse.
Sure.
Certainly, nobody wants to have something that's going to cause them pain.
Yeah.
So there's the fear of pain that comes into an issue with arousal, which can decrease lubrication.
All of it.
And a lot of times you tighten up.
Yeah.
And that in turn can cause more pain.
So what about your pelvic floor is causing the pain?
So I think it depends. We have to evaluate for that. We have to evaluate for that because painful sex can be from infection.
Okay.
It can be from pelvic organ prolapse or some some suboptimal issues there with things coming down.
Okay.
It could be from scarring, whether it's scarring from childbirth,
right,
or from a previous surgery.
Well, what about the husband stitch? Do you know about the husband stitch?
Well, we call it his peronia, or it's a pain in his from his standpoint. But I have not heard your actual definition for a husband.
From what
stitch.
I was taught, while I was pregnant, at the end, tearing is normal with pregnancy.
Yeah.
And so you get stitched up at the end.
Yeah.
And then they'll put an extra stitch, aka the husband stitch, to make it better for him because you have the opportunity to do so.
It can be a little bit tighter. So yes, and in that sense, it can be more painful with that.
Yeah.
And as I mentioned with the pelvic floor, just with the history of having pain, whether it was initially right after delivery or whatnot, then your body has a tendency to automatically your pelvic floor gets into a spasm.
Yeah.
And often that becomes more of a propagating factor. So even if things become looser with time, there's a lot of women that need pelvic floor rehabilitation. And I work very closely with a pelvic floor physical therapist.
Okay, well, talk about that. What do you do in pelvic floor physical therapy? Are you like using the trampoline? Do you have ropes and things? What's happening?
So a pelvic floor physical therapist, they are, of course, a doctor in physical therapy, but they had special training in the pelvic floor.
Okay.
So you'll meet with them. They'll evaluate how you walk, your alignment. They'll do an external evaluation and sometimes an internal evaluation.
Oh.
But with them, they'll assess where things are at, where things are tight, teach you how to loosen things, as well as how to properly do Kegels.
That was my next question.
We'll come back to that. Yes. Yeah. Because how many women, we talk about Kegels, but they don't know how to do it right.
Well, I used to teach yoga, and we call them the bandhas. You want to have the bandhas, and that's a whole other story. But people are like, well, how I was taught to do a Kegel is to, quote, close all your holes. And I'm like, what does that mean?
Yeah.
Like, also, what? Yeah, so
yeah.
I feel like this is something that could be taught a lot sooner because even before I gave birth, my gynecologist and my prenatal yoga teacher was like, you need to start doing Kegels now to strengthen your pelvic floor. And I'm like, I don't know what you're talking about.
Right. Yeah.
So,
yeah. I think even with handouts and the reading things, it's hard to really know, are you doing it correctly?
Yes, exactly.
I think, as I mentioned, as a society, we're a little bit more open to it. So there's a lot of apps out there. There's a lot of other devices.
How's my phone going to know if I'm doing a Kegel right?
Right. They kind of coach you through it.
I was about to say, is there like an attachment that I don't want?
There are some devices that you can put in, and they go through Bluetooth, and it gives a little bit of what we call biofeedback, which you might be familiar with. And if you're using the right muscles in that area, it goes and shows a little curve on your phone. So there's various products out there, which is amazing to have now, which we didn't have before. But certainly, I think that if you're really struggling with issues, a pelvic floor physical therapist is really one that can give you the best guidance on, hey, how are you? And it's not just a general for everyone. And what can you do?
So if you're having painful sex, if you are peeing when you jump or sneeze or do anything, for women, these are kind of everyday things. But those two things, and those are just off the top of my head, those two things are something that you could go see a physical therapist for. They're serious, quote unquote, serious enough.
Yeah. So from our standpoint, these are not life or death issues, right? But they're a quality of life issue.
Yes.
And so how much is this impacting your quality of life?
Yeah.
Because, again, you can just deal with it, put a little pad. Many women do that. But it comes to the point sometimes that you're starting to limit, hey, I want to go dancing, and I can't. And I have some women, hey, I'm getting back out to dating. I don't want to laugh so hard in the date.
Yes. Well, it's not just that, too.
Like,
musical yoga, whenever you, you know what I mean?
Yeah,
you go down a downward dog and things happen. And you're just like, oh my God, it's terrifying. You didn't hear the intro to this podcast, but I did discuss that. Yeah. All right. So last question is, what is a cool fact about the pelvic floor that we don't know about?
I have to pick out what is it really, because I talk about this all the time. Yeah. But I will tell you this: the pelvic floor, particularly right after delivery, can remodel dramatically.
That's crazy.
And that's important to note. I think that the first 6 months after delivery is the most crucial time to remodel the pelvic floor.
So that's the time you should be going seeing the physical therapist.
A physical therapist, doing those Kegel exercises, and just recognizing that there are other options out there.
That's such good advice.
There are women with, I had alluded about pelvic organ prolapse, they will have stage 3 out of 4 stages. So it's pretty dramatic after they deliver, but it can go back to stage 1 in 6 months.
Oh my gosh.
And so that's a crucial time for you to be doing these exercises. Of course, avoiding really heavy lifting and repetitive high intense interval training at that time. I'm not saying that you can't get back to that later.
That was my next question. Is it too late if you didn't do it in those 6 months?
So it's not too late, but I will say that first 6 months is the most critical time for remodeling.
Okay.
And if you are breastfeeding at that time, it might take longer.
Okay.
And so it may take up to a year before your pelvic floor gets back to where it was.
But we have to go back to work in 3 weeks, guys, because modern women, we can do it all. Yeah. That's good to know. And give yourself permission. And
give your permission to heal, to remodel, and just know that there are resources out there.
Yeah, and if you want to find some resources, thanks for being here today. If you need resources for your pocketbook, if you know what I'm saying, you can find Andrea Crane at wakemed.org. But pelvic floor specialists are beginning to pop up everywhere, right? Yep. That's so great that it's finally getting the attention it deserves.
Absolutely.
Thanks again for joining me today. This was so informative.
Great. Thank you, Sarah.
If anyone ever referred to their nether regions as a pocketbook, y'all, I don't think I could ever look them straight in the face again. Sarah Has Questions is a production of Capital Broadcasting Company. My guest today was Dr. Andrea Crane, a WakeMed urogynecologist. To find out more about her or any of the other providers from the WakeMed team, go to wakemed.org. If you have thoughts about any episode or questions you want me to ask in a future episode or ideas for an episode at all, send me a message in the link. You'll find it in the show notes. Thanks for listening.